My name is Dr. Michael Morgenstern. I'm a neurologist in New York. I've been involved in prevention since 2005, 2006. Today I'm going to present some data on using face masks for prevention in the setting of supply shortages. CDC currently does not recommend that the public wear face masks. They believe that doing that would lead to more supply shortages. So I'm going to address how this can be done in the setting of supply shortages. It's important to note that both the Department of Health and CDC have in the past recommended the use of face masks during supply shortages. For example, in Africa, for hemorrhagic fever, when surgical masks were not available, they recommended the use of cotton masks for infection control. In influenza plans of different Department of Healths, though the one that was referenced in this article was the Sonoma County Department of Health, they discussed the use of a cloth mask in the event of a shortage of surgical masks as well as N95 masks. That implies that cloth masks may also protect against airborne particles, not only large droplets. Again, if they can be used instead of N95s during shortage, that implies that they have some sort of filtering ability. And that has been shown in research where penetration testing shows that Hanes sweatshirts filtered out approximately 55% of particles in the 20 to 1,000 nanometer range. Now you would have to look at what size particles on average are aerosolized in a particular virus to know if this was effective, but it's likely better than nothing. Let's look at how most coronavirus COVID-19 transmission occurs. As you know, large droplets are responsible for most coronavirus. Here you can see that somebody is coughing, and it has a trajectory of about 3 feet where it can then land on a person directly. It could land on a surface or someone's hand. Now that could land on the hand of the person who's infected, and he could then touch a doorknob, or he could shake somebody's hand, or he could touch somebody's bag of groceries as he's checking them out on a line where he is checking out groceries for 100 people. So what do we do about that? Well, if we recommend wearing masks for every person in order to prevent them from getting sick, of course it's possible that if somebody coughs onto their face, they'll be protected. However, it's also possible somebody could cough and it could get into their eye, or it's possible that they will touch their own eye while they have the virus on their hand, or it's been transmitted to their hand somehow. So from the perspective of preventing infection, any mask wearing may or may not help by itself, which is why most individuals wear visors in a hospital setting. However, wearing masks prevents most of the spread if you are sick. That is because you are blocking the entire trajectory, and therefore you are looking at the infection chain and stopping the spread of infection earlier in the chain. This all appears to be common sense to me. However, this has not been idea, at least in the USA, and WHO does not appear to also recommend that everybody wears masks. It's been cited by other people that the main reason for that is that they're concerned about leading to further shortages. Here are proposed recommendations, but I'm going to skip that for now. I'm just going to share other individual expert ideas because some people might feel that a neurologist is not qualified to comment on public health. So let's just look at what some experts say throughout the world. This is an individual, David Way, that says masks may be particularly important in COVID-19. And this is a divergence of expert opinion. He says patients with COVID-19 frequently have only minor symptoms. In fact, if you look at recent literature, it seems as though there may be up to 80% of individuals who are responsible for transmitting infections that have either minor symptoms or they're asymptomatic or they're pre-symptomatic and developing symptoms, and will take several days until they show up at a healthcare professional before they're diagnosed. And during that critical stage is when up to 80% of infections are taking place, according to mathematical models. So there is inconclusive evidence for masks. But according to David Way, that is not a reason to dismiss wearing masks, since it would be impossible to randomize individuals in a study and conduct a randomized controls trial to not wear a mask and expose people to the virus. That would be unethical. So it's unlikely to ever get this evidence. He then goes on to say, which I've said, if you're standing in front of someone who's sick, the mask will give some protection, as demonstrated in my graphics above. The mask provides a barrier from respiratory droplets, which is predominantly how the virus spreads. And his credential is respiratory medicine expert, Chinese University of Hong Kong, studied the 2002 to 3 SARS outbreak extensively. Here's what Dr. Jeremy Farrar, an infectious disease specialist and a director of a research charity called Wellcome in London, talking about the need to make urgent decisions. We need to make policy decisions, clinical decisions right now, he says, because we can't wait a month until we have the data. Right now, we need to do anything that buys us a week or two, because that delay could have a dramatic effect. I think that is what we're doing. It looks like FDA is already testing out vaccines in individuals, and that's obviously much faster than we would normally see in typical drug development. Obviously, people realize this. The reason why we're not recommending masks to the public, as I mentioned before, and as is pointed out by Professor Schaffner at Vanderbilt, is that if there's a general recommendation that people wear face masks, we won't have enough supply for healthcare workers, as well as the fact that there is scant evidence or they don't fit snugly for members of the general public. They only fit snugly, I suppose, for healthcare workers. But there are other reasons. Anecdotally, I have heard individuals dismiss the wearing of face masks by saying they don't work. There's little chance that they're going to work. And then they qualify, but there's little harm in it. Now, I haven't seen any data that shows that they don't work. But here are other reasons why they might not be recommended. There's a lack of quality assurance and regulation. According to Chugtai, 2015, who does extensive studying on face masks, so I guess he would be the world's authority on it, along with McIntyre. Regulation, wide range of cloth masks or improvised masks used around the world. These kind of go more towards just wearing cloth masks rather than the surgical masks supplied to hospitals, which we've come to rely on. So he's commenting on, why not recommend cloth masks? And I think that there's this lack of reproducibility. So if you're recommending a mask or making an official recommendation for a mask, well, which mask are you recommending? It makes it politically difficult, I suppose, to make a recommendation when you don't know exactly what you're getting, right? Cloth masks include cotton and gauze masks that are homemade or woven, according to his definition of what cloth masks mean. So that includes what you would call a DIY face mask. Surgical masks face similar issues, unlike NIOSH certified N95. He points out that actually these surgical masks that we're using, at least in 2015, his article was citing that they're also lacking in these types of regulations. So we have NIOSH approved N95s, but when you look at surgical masks, they have to meet, I believe, the FDA's criteria. But how that exactly is certified, I don't know. It seems like the company itself can go ahead and just meet those guidelines. Best I know is that they are mostly resistant to liquids. In a surgical setting, they would be useful to protect against splashes, where if you had a massive splash of water or of blood, it would just go straight through the mask. Then there's a concern that cloth masks may encourage risk-taking or decrease other hygiene measures due to a false sense of protection. That might be true. It's a concern that I don't see a lot of data for. So I think if we were to summarize the data, we would have to say the data for any face mask, including the surgical masks, is scant. Let me go to these recommendations that I would consider. And I think we need to consider, because what are healthcare workers to do if they don't have surgical masks? Okay. Should I wear a face mask if you're sick? Let me try to summarize this as fast as possible. This says that individuals who are not sick should wear a face mask whenever they go out in public, to a hospital, or if you're caring for someone who's sick. That diverges from some recommendations that will say, well, only the sick person in a household needs to wear a mask, or that a sick person should wear it only when they're near another person. But if they're just in their house alone, maybe they don't have to wear it. I would say that they should wear it whenever they move around in a house, and potentially consider all the time, though that would be hard to do. If you were wearing a surgical mask, an N95 respirator, not comfortable to wear, you may be contaminating it. That's a possibility as well. But that doesn't seem to concern healthcare workers who have said things like, hey, I think I'm touching my mask all the time too. I don't think that the public is more likely to touch their face mask than a physician would be. I think that is unproven and probably incorrect. I think there was a press conference with a well-known health official who was telling people not to touch their face, and unconsciously was touching their face and nose throughout the press conference. I think that's a good example. And I don't think that I'm less likely to do something that is just something that I do without thought, like fixing my hair, than the general public. I think that's a myth, most likely. I can't prove it, but I feel that's just the case. Now, I'm addressing what type of face mask to wear. And I specifically say, reserve professional masks for healthcare workers. They need them for surgery, procedures, and caring for many sick patients. But I also say that a do-it-yourself mask, including cotton and gauze masks that are homemade or woven, may substantially reduce the spread of coronavirus. And that's just common sense. If I were to stand in front of this camera lens and cough on it, it would get all wet. If I just took anything, some piece of paper that I have lying around, for example, folded it up and coughed on it, there's going to be nothing on that lens. And really, that barrier of prevention is the most important thing. Similarly, I'm at the very least going to prevent myself from touching my mouth or nose if it fits over my mouth or nose. There may be a need to educate the public on exactly how to wear it properly, or to take it off, or dispose of it, or clean it, if, in fact, that is the recommendation that's being made. But I think almost any healthcare professional would agree that something covering your face is better than nothing. I think we would also agree that if something does not lead to depleted resources for healthcare workers, that it should be something that is tried if it's going to impact the number of people that end up infected. Because ultimately, stopping the infection earlier in the chain will require less face masks to be worn by healthcare workers. So it's sort of the short-term versus long-term strategies that have to be balanced. Unfortunately, it seems as though healthcare workers are also now out of face masks in general, the N95s, as well as just the surgical face mask. And I have to clarify that those surgical face masks, there's no data, as far as I know, there's no good data that shows that they work any better for barrier protection than a piece of paper does, or than a cloth mask with several layers. There might be some data on paper, but it's not substantial. It's going to be scant evidence. So now let's go back to the point and counterpoint. All right, and then we'll look at some history. Actually, let's start there. In the past, cloth masks have worked and been recommended by the DOH and CDC during supply shortages. So, according to McIntyre, another authority on face masks who's worked with Chugtai, non-disposable cloth masks were used to protect healthcare workers from scarlet fever, measles, influenza, plague, and tuberculosis. This is before regular disposable face masks came about. The use continues today in developing countries like India because they last long, they're easy to carry, non-allergenic, comfortable, affordable, and washable. This comes out in an Institute of Medicine 2006 report where they were charged with looking at the reusability of N95 respirator masks. Now, they also, even though this wasn't their mission or directive, they also did mention cloth masks in this study, and they did not conclude not to wear cloth masks. They did not conclude that. They said, we've got to do more research on this. Of course, we don't have great data on this, nor will we ever. During the SARS outbreak in 2002, according to this Institute of Medicine report, the public in Asia was encouraged to wear reusable gauze or cotton masks that could be washed with disinfectants. It could be sterilized with high pressure and temperature. I think there's some data to suggest that a microwave would be useful to disinfect or sterilize a cloth mask after it's been used. So theoretically, somebody could put on a mask that's made at home with some cotton, wear it outside when they go to the supermarket, come back home, put it in the microwave with possibly some water for 1 minute or so, and that should probably kill virus if it is there. Use of masks, social distancing, and hygiene were found to be strongly protective and significantly reduced the risk for SARS. Now, use of masks goes along hand in hand with social distancing and hand hygiene. In these circumstances, encouraging masks in the public did not lead to decreasing other methods. And I think that it's unlikely that it's going to encourage people already sitting at home and scared for their lives to not wear face masks in the public if we were to say, go ahead and make a cloth face mask. CDC, then again, just to repeat this, the CDC has recommended the use of cotton masks for infection control of viral hemorrhagic fevers in the African healthcare setting when surgical masks are not available. And regional pandemic influenza plans discuss the use of cloth masks in the event of a shortage of N95 and surgical masks, which implies both barrier protection against large droplets as well as against airborne particles, which research has shown, based on their penetration testing, there is some reduction in airborne particles. Let's go to counterpoints where I explain some of the arguments for and against. If there's a general recommendation that people wear face masks, we won't have enough supply. Agreed. If we were to recommend exactly the same masks, that would potentially lead to diminishing supply. It has to be pointed out to the public that we need to prioritize masks and other equipment for healthcare workers, such as gloves. However, recommendations for cloth, DIY, or home masks will not affect the healthcare worker supply. Secondly, scant evidence. First point, there is no conclusive evidence for any medical masks. It's sufficient for medical professionals. So if this data is sufficient for medical professionals, it should be enough to recommend to the general public. Then, in addition, even if evidence, as Dr. Way said, evidence is lacking, that is not a reason to dismiss, because we need to do anything to buy us time. Any delay could be devastating. You can't say, let's wait a month. You can't say, let's wait a year. We need to make decisions now. RCT for masks, not possible, okay? Not ethical, won't happen. But there are at least 19 studies on cloth masks that suggest efficacy as well as anecdotal data from those IOM reports. Then the other question, snug fit, I think that's not an issue for barriers from large droplets and not relevant to current guidelines, as N95s are only recommended for physicians who are performing procedures that are going to aerosolize the virus, or theoretically are going to aerosolize the virus, doing intubation and bronchoscopy and other procedures in the ICU. Surgical masks used in healthcare have similar issues to cloth masks because they don't have the same NIOSH certifications. If you're worried about the fact that we're not going to have a reproducible effect, if we make these recommendations. I think that's true, but also something that exists in regular surgical masks that we take for granted, must be proven, must be researched, must have these standards and certifications, which they probably don't. As I mentioned here, surgical masks superiority, and this is from the IOM report as well, appears to be in its ability to be used in an operating room because of the ability to resist fluids. As I mentioned, it's currently used throughout the world where they run out of masks, and their doctors, who are quite smart, they've found over time, I guess you would call it not evidence-based medicine, but medical-based evidence, shows that they work. And here are about 18 or 19 studies just on masks that are homemade or woven or made out of cotton. All of them seem to show there's some effect. You could argue that they're not strong data, and that would be fair. But I think it is common sense that any barrier will work better than no barrier. These are the recommendations that are proposed. And I would just say that you have to consider, even if there is social isolation, which is a good idea, and we're all sitting around in our house, that's going to work to stop infection because we're lowering the probabilities of each person being exposed. However, just like a mosquito in malaria that finds its way to somebody who's sitting around in a house, not outside drinking something that would infect them with malaria, that vector comes along and bites them. It comes around from outside the home. And what happens is that naturally people have to leave their house to go to get groceries, to go to get food, to go to a hardware store. And there's people there at the checkout counters that are just not wearing masks. Okay? They are typically wearing gloves, which would be great if it weren't just acting like their hands. They cough into their glove and they touch their eye or face. Now, that's not going to help unless they keep on switching their gloves. And let's face it, they're not doing that. If they were wearing a mask and sanitizing their hands every once in a while, I think what you would end up with is individuals who are not going to be infected and are not going to be passing it on and touching, cough, and then touch every single item on that conveyor belt and then handing it to somebody right away, where you have the risk of this indirect transfer of particles that clearly is a risk. And then the problem is, of course, that that person then goes back to their isolated home, where there might be old people, fragile individuals, and they, in theory, will infect those people. Its isolation is better than nothing. Social isolation is better and great, and of course is used for the same reason that we go ahead and we tell people to stay 6 feet apart, cough into the nook of your elbow. Okay, that's another barrier method. We're trying to stop these large droplet transfers, but there are situations where that is not happening. That's why we have a virus that's spreading like crazy, and we need to do everything we can. You look at data, you look at anecdotal data, it seems to suggest that wearing a face mask whenever you go out in public, like they do in Asia, like they do in countries, by the way, where the curve is somewhat flattened, and I'll show you a little video that I put together, which is still a work in progress. So it seems to be done in other countries that are doing a good job to flatten the curve. And it's still a work in progress, but I'll share this with you. I think that we really need to strongly consider advising the public to wear face masks. Now, it doesn't have to be a face mask. It really has to be a barrier of protection. I think another thing that could be considered, it doesn't have to necessarily be a mask. It has to cover that area. It could be made out of plastic material that also acts as a visor, but also would trap particles, large droplets. And I think there's a benefit to those because if, for example, you cough into a shield or there's any liquid on a shield, you can see it and wipe it off. That is in contrast to a mask that even if it's slightly wet, you might not notice it. So if you're going ahead and you cough into a shield or you cough on a shield or have something on it, you'll see it, and then you won't necessarily touch it and then go ahead and infect. So it kind of gets around the issue that you have and the concern of individuals who are coughing into a mask or contaminating their mask and then touching a contaminated mask and doing worse damage than better. But I think overall it makes sense that any mask is better than no mask, and that having the public wear masks that don't interfere with the supply of healthcare workers would be a good idea and something that should be implemented ASAP if we're going to flatten out this curve. Thank you for your time, and feel free to reach out to me if you have any questions.